Hi, this is Narsinga, and you're watching Personality Disorders. Your personality traits are the ways that you perceive, relate to, and think about the environment and yourself. And these traits tend to develop very early in life, and they last or endure over the span of your life. A personality disorder is when these traits become rigid or maladaptive and cause significant functional impairment or emotional distress. So basically, they're problems with mood and affect. They tend to be influenced by a variety of biological and psychological factors that include heredity, temperament, learning, social interaction, and culture. They are not psychotic episodes or issues because psychosis has major disturbances of thought and personality disorders do not. Included in personality disorders are schizoid and schizotypal, which we talked about during the schizophrenia spectrum disorder talk, and they are kind of reviewed here as well, but I'm not going to go very deep into those two topics. Personality disorders are broken down into three clusters. Cluster A are the odd or eccentric kind of behaviors, and those include paranoid behaviors, schizotypal behaviors, and schizoid behaviors. And all three of those really fall on the schizophrenia spectrum. Cluster B are dramatic or erratic behaviors, and these tend to be some of our very dangerous personalities. These are antisocial, borderline, histrionic, and narcissistic personalities. Cluster C are patients who present feeling very anxious or fearful, and they have avoidant personalities, dependent personalities, and obsessive-compulsive personality disorder, which is not the same as OCD. So let's look at cluster A first, our odd or eccentric behaviors. Again, these fall under the spectrum of schizophrenia issues. So the paranoid personality disorder has a pervasive mistrust of other people. And really our main concern with patients who have persistent paranoia is that they are at increased risk of violence towards others due to these paranoid thoughts. Schizotypal has odd beliefs and thinking, these ideas of reference, and they tend to think magically. Depersonalization is not uncommon. They're very superstitious. They believe in clairvoyance and telepathy, or this kind of sixth sense, and they believe that other people can feel their feelings. They oftentimes will make references to, past experiences like other lives, other worlds. During times of severe stress, they may exhibit a psychotic episode, and that would include hallucinations and delusions only under severe stress. Usually they don't have any psychosis. Schizoid is just kind of your loner, your eccentric, isolated, lonely personality. They don't form relationships with others well, and they prefer animals and just being alone. Cluster B are our group that's very dramatic, emotional, and erratic. This includes, again, antisocial, borderline, histrionic, and narcissistic. Antisocial personality disorder exhibits very aggressive and impulsive behavior. They have absolutely no regard for the rights or safety of others. They don't feel remorse if they hurt somebody else or destroy their property. They have this sense of entitlement, so if they see something and they want it, they think that they're entitled to it, and that includes people and possessions. They don't adhere to traditional values or standards of morality, so they won't act along social norms, ethical or moral norms. They typically can't hold down a job or maintain financial responsibility because they lie, steal, and engage in illegal activity because, again, they don't follow social ethical norms. The person may be gregarious and likable on the surface, but will flip like a switch if you cross them or question them and become incredibly hostile and aggressive. Antisocial personality disorder tends to develop very early on. It's associated oftentimes with ADHD and conduct disorder, and the person usually has a history of physical abuse. When caring for someone who is experiencing antisocial personality disorder, you want to be very careful about safety and monitor for violent behaviors. Establish firm limits and talk about the consequences of violation of those limits. It's important to avoid power struggles because that will just set them off more. You can use antipsychotics as needed. Drugs like risperidone are oftentimes fairly effective. Provide positive feedback for positive behaviors, so not just focusing on the negative, but rewarding the positive. And promote insight as able. Patients with borderline personality disorder are said to walk the border between the other types of cluster B personality disorders. They tend to have picked up kind of the worst habits of all of them. They are antagonistic, inappropriate. They tend to have very wide mood swings, very impulsive, self-destructive. They take risks, and they're very manipulative. Looking again at the group of people, they tend to have poor impulse control, intense and chaotic relationships. Depression is very common in this group, and all of this is related to an underlying fear of abandonment. They manipulate others to allay that fear of separation, and so really what they're trying to do is keep people from leaving them. They use splitting behaviors and tend to classify things and people either as, good or bad. So all these people are good or all these people are bad. They cling and then they distance. And this can be very confusing, especially to the newer nurse working in a mental health setting or taking care of a patient with borderline personality disorder, because when they appear very, vulnerable and needy and pleading with you for help and attention, that tends to be very attractive and you want to help them. And then if they don't get what they want because you've set limits, they will turn immediately, very impulsively, and even with self-harm in order to manipulate your feelings or to make you feel bad. Recurrent suicide attempts and self-mutilation are common, and these patients oftentimes will hurt themselves in an attempt to manipulate the situation or to gain control. Our main goals when we are caring for a patient with bipolar disorder is to provide for safety and security. Every patient who comes in should be wanded, clothing removed, personal items removed, placed in safe clothing, placed in a safe environment. Anything that could hurt them needs to be removed. Be as empathetic as possible. Try to understand how scary this is for them because the fear of abandonment is very real. Address behaviors when you see them. The person is not bad, the behavior is undesirable. And so talk about the desired behavior and what it is that you want to see happen. So if people are throwing things, we talk about not throwing things. If people are yelling, we talk about using our inside voice. If people are swearing, we talk about, using proper language. You want to reinforce, again, the positive, but talking about the desired behaviors that you want to see while the person is on your unit. Deal with manipulative behaviors by setting boundaries. Be very clear and point them out. Every person should have the same boundaries. It's not okay for one person to be swearing and throwing things and the other person not be allowed to do those things. Be available, but discourage dependency. So if they need you for something that's nursing related or legitimate, you always want to be available so that they know that they're important, because again, their fear is going to escalate if they feel that they're being dismissed or if they feel that they're being abandoned. But you want to discourage dependency so they can't need you for everything and they can't need you every minute. Be consistent among the staff in reinforcing all of the expectations and the rules, and really maintain your perspective and stay cool. Do not allow yourself to be antagonized. Histrionic personality disorders are what we would term as our drama queens or drama kings. These are people who tend to follow a pattern of excessive emotional and attention-seeking behaviors. We usually see this onset by early adulthood and present pretty much pervasively throughout their life. They are very uncomfortable when they're not the center of attention. They're usually inappropriate, sexually seductive or provocative. They have rapidly shifting, shallow expressions of emotions, consistently using their physical appearance to draw attention. They like to impersonate other people, and self-dramatization, theatrical experiences, or the kind of showing off, exaggerated expression of emotions, easily suggestible and influenced by others, and they have a hard time forming deep relationships or maintaining relationships, but oftentimes feel that their relationships are more intimate than they actually are. These are patients who the smallest injury or issue becomes, this huge dramatic event. Narcissistic personality disorder are patients who have an exaggerated sense of self-worth and view themselves as superior to everyone else around them. They lack empathy for all humanity and other people. They lack humility. They lack the ability to see themselves realistically. They tend to be very hypersensitive to evaluation by others, oftentimes, stating that other people don't have the right to evaluate them, and they become enraged by any criticism. They believe that they have the right to anything that they desire and will exploit others for self-gratification. They usually have grandiose distortions of reality. Their mood is usually optimistic, relaxed, and cheerful or carefree, but then will change, on a dime if somebody challenges them or tries to embarrass them, and they will fly into a rage and try to cut the other person down. Cluster C personality disorders are anxious and fearful disorders, such as avoidant, dependent, and OCPD, which is obsessive-compulsive personality disorder. Avoidant personalities are people who suffer from a mental condition that has feelings of inadequacy, extreme shyness, sensitivity to rejection, and an inferiority complex. They have a pervasive pattern of social inhibition, so they'll go out of their way to avoid activities that involve interpersonal contact because they have a fear of criticism, disapproval, or rejection. Patients with dependent personality disorders lack self-confidence and develop an extreme reliance on others to take responsibility for them and make all decisions for them. They tend to be very submissive, self-deprecating, and inwardly pessimistic, although outwardly may appear very happy and calm. And obsessive-compulsive personality disorder, which is not the same as OCD, is someone who's very serious and formal, very, very strict, overly concerned with orderliness, perfectionism, and control, incredibly inflexible in thinking. They just want to follow the rules, they want to follow the list, they want to follow the schedule. They're very devoted to work and productivity to the extent that they exclude social and leisure activities and they exclude their family. Treating personality disorders is very difficult. Medications are largely ineffective. They're used only to treat the symptoms that the person is experiencing or any secondary disorders such as anxiety or depression. There have not been any medications found that actually treat the personality disorder itself. Developing a safe and therapeutic milieu is very important to working with the patient who has a personality disorder. For patients who have borderline personality disorder, dialectical behavioral therapy is showing great promise. This is a combination of group skills training, individual psychotherapy, and the ability to contact a therapist 24 hours a day, 7 days a week by phone Having that person as a backup helps alleviate some of that fear of abandonment because you always have that kind of person in your corner. And then the team meets regularly to reevaluate and discuss the case and to see what's working and what's not working. So it's kind of a four-pronged approach. So some general concepts in the care of personality disorders. Remember that especially cluster B tends to be very manipulative, aggressive, and hostile. And patients who are paranoid from cluster A also have a very high risk of becoming violent. You cannot allow these behaviors to be tolerated. So be very firm and be consistent in setting limits. Use clear, calm statements and take a confident physical stance. Ask for backup or additional people to help you if the person does not back down. Reward appropriate behaviors by contracting for privileges on the unit when the person displays behaviors that you feel are desirable. So really focus on the positive and help them figure out how to be successful in changing their behaviors. Because this is really a mood affect kind of behavior issue. Thanks for watching.